Thank you, folks. That felt very familiar. Anyone else? No? No? I even think I saw some of our members there sneaking away to Connecticut. It gives me great pleasure to introduce the panel here. Please welcome to moderate Sheila Nevins. Thank you, Sheila. Mary Lake Polan, we already introduced her. Right here, Sheila. We'll get you guys microphones. Frank Bennack Jr., thank you so much for being here. Linda P. Freed, and of course, Kathleen Turner. Sheila, as everybody turns their microphones on, I'll hand things over to you.
Can you hear me?
We hear you well. Thank you, Sheila.
Hi, thank you so much, and thank you for this lovely film. You did a great job. I mean, I had nothing to do with this film, but I have a lot to do with getting old. And can you hear me?
No, yeah, I need the mic, baby.
Okay, baby, fix it.
Need help on turning the mics on.
I can't. Is it not working?
You can speak into it.
Still not on.
Okay, am I speaking into it?
No.
Can you hear me? No. Oh, you mean I didn't have it on? I'm a real professional. Anyway, thank you for this film, and thank you for putting your heart and soul in it. This is a film with real heart and soul, and there's a lot of docus that are fancy, but they don't have the spirit of this. I mean, how many of you felt choked up when you watched this? And how many of you saw yourself in the film or someone in your family? So I'd like to thank you for that.
Well, you're very welcome. That's actually what we want.
Well, now you can leave. You got the whole thing.
Go have dinner, yeah.
The whole thing is done. No, I would like to congratulate all of you. And I think the important thing here is that there are very few films about aging. I've made a lot of films, and getting old is a very lonely experience in America. There's a lack of reverence, and then there is the actual physical disability that comes with aging, and a lack of empathy and a certain kind of bias and prejudice. And so there are very few films like this, and I think they're very important because you see yourself, you see your family, and you extend a certain kind of empathy to a process that's supposed to be a joy and in many ways is, and in many ways is not. So I'd like to hear from each of you and your involvement in it and how you feel about this, because I don't really know you. I've just met you. And should we start with you, Mary? Mary made this film, or do you want to start with someone else?
I think we should start at the other end.
I don't think so. I think we should start with, no. I'm really very easy to get along.
Okay. Well, that's exactly what I wanted people to feel. I didn't understand that when we started making this film. But I turned 80 last summer, and suddenly everything changed. And I looked around and I thought, well, how do you live long and well? And I'm interested in public health, and I'm a physician, but I think it's more than just what you eat and your exercise. I think it's that sense of community, and that's what I learned from the film.
Okay.
Well, first of all, that's my wife, in case you didn't know, and that we're co-producers of the film, but I'm here somewhat for a different reason. I'm 91 years old, and thank you. People say to me sometime how great you look, when really what they're thinking is, we thought you were dead. My point tonight is that it's all about engagement. With the world changing the way it is, and with the number of elderly people growing so dramatically, those of us in business, I think, have to look at the world differently. And the idea that 65 is the time that one should retire is antiquated. And many companies have not yet learned that, but they should for a variety of reasons. First of all, many of the people who go out the door at 65 have great wisdom, great things to offer the company involved. In addition, for those individuals, community is critical. That's basically what the film is about. That double entendre of below surface. Well, you saw what was below the surface was a great community. And so part of my crusade is to try to get people in our world, and as you know, as someone in business as I was as head of Hearst, Warren Buffett and Rupert Murdoch and all of these 90-year-olds, they didn't get to be 90 years old sitting on the beach. They got to be 90 years old engaged. Even President Carter didn't get to be the oldest living ex-president because he went out and did nothing. He had a great passion for what he did. So my message is a simple one. Don't quit. Do whatever you need to do to be in community. And I think the data, Linda would I hope, verify this, that notwithstanding all of the medical and other issues that are involved, by the way, I do not do Aquafit. True confession.
I could have sworn you did just by looking at you.
And in any event, what I think is that while exercise and diet and having great doctors and all of that matters, I think the data shows nothing matters more than community. So that's really,
That was
Sheila.
beautiful. Thank you.
Hello. Am I on? Yeah?
Yeah.
Well, I am the kid here. I just turned 70. But my life is in a great deal of transition, and this is an exciting exploration to me because in my work in a film or on stage, you have an incredibly tight, artificial family. For 3 months in a film or for 11 months on a successful run, you are seeing the same people and working with them and loving them and living with them, hours and hours and hours, 6 days a week. Now, as that changes, because both physically, I've had rheumatoid arthritis for 30 years, so I don't think I'm doing 8 shows a week anymore, though maybe 6, we'll see. In any case, so I started to cast about last year on what I could do both to expand my community and to do something I love, and that is teaching. So last fall, I sat down and wrote a resume, got some recommendations, and sent it out to all the local universities. So this past spring and next fall, I am a full adjunct professor at Pace University. My course just finished this last week, and I had 2 classes of extremely bright, most of them, exciting young people. And now you know that working with young people also gives you back a sense of the passion and exploration and the sense of passing it on and the responsibility therein. I'm building a new community this way too with the faculty, people that are from a different world than my 45 past years. And it's an exploring journey. It's exciting.
Well, good evening. Maybe I'll try and make some comments from a different point of view, because I really love this film and I love what's below the surface of it. So thank you. So I'm a geriatrician and a scientist, and many years ago, I was seeing patients who kept telling me the same story. They had come to see the doctor because they were feeling sick. They were feeling sick. And when I talked to them for a while, I realized pretty consistently that they had gotten sick because they had no reason to get up in the morning. And the person who taught me that was a gentleman who was in his mid-60s who had retired about 10 weeks before I first saw him from being the CEO of a large multinational corporation. And he had gone from being on top of the world to 10 weeks later being invisible. And really having no sense of what to do. And he did get sick. And when I saw him, it was clear to me that seemed to be what was going on. There's no pill for that, or there shouldn't be. So I wrote him a prescription, because I was used to writing exercise prescriptions. So I wrote him a prescription and said, go out and find something that matters to you, and join an organization that does it, and then report back. So about 2 months later, he came back and he said, I went to the organization I really care about, and they took me as a volunteer, and they put me in a corner licking stamps. I heard this story so many times. So what I learned, aside from, they didn't teach me any of this in medical school, but I spent a huge amount of time trying to understand what was going on. And what I realized was, first of all human beings at every age have the same needs. A need to have a reason to get up in the morning. A need to get up to do something you care about. A need to have meaning and purpose. A need to feel that you have a valued place somewhere for some people. And that your presence in this world actually matters. In addition, people want, as we all get older, the evidence is that for most people it matters to take stock and say, am I leaving the world somewhat better than I found it in some way? And if I haven't achieved that, how can I do it? Now, none of what I just said applies to everybody, and certainly not the whole list doesn't apply to anybody. But that's what I learned, and then I realized that too many of my patients came back not able to fulfill their prescription. And so, I fast forward 3 decades or more, and what we've learned is that we actually have to create a society for our longer lives in which there are roles and place and organizations to meet what's meaningful and purposeful and validating and resolves the loneliness that people otherwise feel. And so Aqua Fitness clearly does that. The JCC, I'm sure, does that. There are some organizations which are all about that, but they are very few. And we need to together figure out how to create this new social infrastructure for the longer lives we have, with an understanding that it's good for us, and it's actually good for everybody. Everybody flourishes because of it. Thank you.
That was very helpful. Thank you. Thank you very much. I act like I think that I know the answer. I do not know the answer. I'm 85. And you're supposed to go, I'll give you another chance, okay? That was very interesting. Thank you for that. I'm 85. Anyway, I've done a lot of work. But anyway, that's beside the point. I think this is really very important because this is a society in which age, for most of us middle-class people, I'm not talking about the poor or the very rich, age is a bit of a disgrace. It's embarrassing. I actually did a podcast with a woman who was my age and who refused to say how old she was. So the question was really, why was she even on the podcast in the first place? So the whole idea of being ashamed of your age is really part of this thing. And I think it's very important that industries understand what you said, sir, which is that, I was at HBO until I was 78. They kicked me out because I was too old. I got another job for another 6 years or 5.5 years at MTV. And I did wake up about 5 days ago and say, what is the meaning? What am I supposed to be doing? Then Isaac asked me to come here, so I guess it's okay. Anyway, I think, would it be okay if we took questions from the audience?
We'd be happy to take some questions from the audience. We'll pass the microphone around. I'm going to start with one right here.
I'm just curious, Kathleen, what it is that you teach at PACE.
Acting.
What is that?
Acting.
Oh, acting. Okay.
Amazing.
We have another question over here.
My question is in terms of choosing what is important to you, because I'm very, aware of time. I have cancer. I'm a retired attorney. And I found notes from like all these years of ideas I had, because law wasn't all that fulfilling, of things I wanted to do to quote unquote change the world. Giving a lot of personal information. I'm a child Holocaust survivor, so I thought I have to do something to make a difference. But I feel the pressure of I have to pick the right thing because I don't have a lot of time and it takes so much time to start a career. So what is your advice to me?
I want to say something to that. I want to say something. Is that better? Yeah. The trick is to show up. Really, if one is more important than another, that's not it. What is important is that you show up and you do what you can. Everybody, my whole life, outside, you need something more than just your day job. So, volunteer for City Meals on Wheels. I work with People for the American Way. I work with Planned Parenthood. I work with Amnesty Internationally. It's not any one, well, People for the American Way is my one big job. But the point is, if City Meals calls up and says, we're having a thank you for the volunteers of the organization at 5 o'clock at this, would you come help? Just show up. That's the key.
I would add to that you can make what you do important, that your being there can make a difference in, it's not necessary to have chosen the most important thing. Something I wanted to add to our earlier discussion. People don't think much about this, but the disappearance of the defined benefit pension plan means that we're going to have a generation that's going to find it very difficult to retire, because as great as 401ks are, many, many young people do not make the provision that will allow them. And so those of us who have any influence on anything, and as an aside, I've been since 1979 on the board of New York Presbyterian Hospital. I ultimately chaired that board. I've been on the Lincoln Center board. So it doesn't matter a lot what you do, but you have a community, people who care about you and you care about them. But society at large is going to have to cope with the challenge of this aging population. And a lot of them are not going to have the wherewithal to retire. And we're going to have things they can do that make them feel productive.
Before we move to our next question, I want to give 3 shout-outs here. I'm coming to you from over here now. I want to give a shout-out to Carolyn Colas, who runs our fitness center here. To get involved with the fitness programs, that's one of the people you should speak to. I want to give a shout-out to Susan Lecter, who runs our Center for Aging here, and a person to speak to get involved there, though there are many other here with the teal Wexler shirts on that you can probably find them. Of course, Joanna Samuels, who is our executive director here, to speak to about all things about being part of a community and how this community center here can create all the beautiful things we're seeing in that movie and that we're talking about here today. We're going to take a question now from right up here.
First of all, thank you for that film.
I think that I'm terrible with names, except that I know now most of you, and all of you are like idols for different reasons. And Dr. Freed, I've studied all your work because I'm a geriatric clinical specialist. I was over 20 years at New York Presbyterian Hospital, and I'm trying to make a documentary. So, and I have a podcast called Wisdom Shared, and I'd like to officially invite each of you there. And I'm 60 years old. Just to start with that. So one of the characters, or the main character there, I mean, the instructor, the very inspiring woman, I think she answered that question that woman said was what brought her back was doing for others. And I think that's a problem with our society. I think we're just become so sort of selfish and self-involved. And the other thing I want to just ask, this is a question. It's a public health issue, as I see it. It's so frustrating. Here I'm a physical therapist, try to help people. I'm an aging specialist. You know, I can do one person at a time, but it's like a global problem. And I know that Columbia University has the whole aging thing. A lot of people are looking into the drugs for longevity to make their genes better. But what about like when we're living, how do we be happy and contented and feel like that we're not, canceled?
I can't resist asking if I can respond. So this is a big public health issue. We now know a fair amount about one part of that, which is the experience of loneliness. Loneliness has been socially constructed over the last, since industrialization, to become increasingly prevalent and is particularly high as people get older, but it's also high right now for young adults and adolescents. It's socially constructed by a whole variety of forces, which includes our obsession about independence and autonomy, but it's exacerbated by our lack of investment in a social infrastructure that can bring us together, so that every person doesn't have to reinvent the wheel. And what's the consequence without that? Well, the public health consequences, as you just said, are really high. So chronic loneliness, which is unfortunately too much of a default option for too many people, causes certainly depression and anxiety. It actually changes your mental affect when it sticks around for months and months, because it causes you to change from rose-colored glasses to blue lenses, in which people actually weigh their interactions in a very negative way, and that drives a worsening of connections. People withdraw because they're interpreting an interaction in a way that actually they think is negative, but somebody else would have thought was fine. And then on top of that, it causes inflammation, which actually worsens or creates heart disease, stroke, and a lot of other adverse conditions. So loneliness is really bad for your health. On the other hand, it's very positive because we're genetically encoded to feel the experience of loneliness, which is, it's not a disease, it's a dis-ease, if you will. It's painful feeling, which the evolutionary biologists think we are encoded for so that we know we're not having the interactions and meaningful relationships we need. It's like feeling hungry. If you feel hungry, that's your body's signal that you should get some food. If you're feeling lonely, it's your body's signal that you need different kinds of interactions with people. And those could be people you love already. It could be people you'd like to love. It could be family and friends where the relationships are not as meaningful and gratifying as you would like. And it could be a different kind of loneliness, which they call public or collective loneliness, which is the need to feel a valued member of a collective identity that makes a difference. Thank you.
We have a question up here.
Hi, I've been volunteering for many years with a wonderful organization called Dorot up here on the Upper West Side and up in Westchester, and they have amazing programs that connects seniors, and also I facilitate in-group programs where seniors come in, we play board games, or we have a lecture on an interesting topic. And another facet of their programs is to bring in younger people, high school students, even younger than high school. And I met some of these people when we had a Volunteer Appreciation Day, and I was fascinated by all these kids who were so happy to come in and help with computer classes or play games. And I was wondering if you have any ideas how to bring and engage younger people, teens, just to come and engage with seniors. It's a wonderful thing.
For
Very
the younger
important.
people or for the seniors? I mean,
Both.
for both?
Probably for both.
I don't think it's that easy. I don't think it's, I mean, you doctors would know more than I, but is the human being created to be this social at a certain age? I mean, because the suicide rate is highest for men over the age of 51, and the suicide rate for young people is increasing rather rapidly. And I've done several films about that. But it seems as if this loneliness is partly, it's not just aging, it's social media. And it's, does it have anything to do with the human character, which is that it's very hard to step out of yourself into the world at large, especially when you're older, especially if you're depressed. And, it's almost an impossible mission. And as far as young people being engaged, I mean, I work with a lot of young people, and they're definitely not engaged with older people. As a matter of fact, they're scared of them.
You go ahead.
I just wanted to say one thing. I do know of, in doing these panel discussions, we have had people from AARP talk, and they actually have, to your point, individual programs that pair teenagers who know how to use and work their iPhones and can help the older people with the getting on the internet, and the older people help the younger people calm them down, tell them not to get so upset, that life will change. So they have an interaction that benefits both. And I know that they have specific programs that help this kind of intergenerational action.
I have been for years telling my students, because I've been teaching for, when possible, for a very long time. This is the first time I've actually taken a position of long, length. Anyway, I tell all of them to choose meal delivery, soup kitchen, reading to the elderly or the blind. I mean, there are so many things. And schedule it in their phones as they would a class. So if 2 o'clock every Tuesday you have an English class, put in your phone that at noon every Wednesday you show up at the soup kitchen and you treat it as part of your regular schedule, and it will grow from there.
Of course, I'm too.
Time for one more question. Would that be good?
I'm too
Sorry.
young to join AARP, but I would make another point, and that is, like so many things in life, the younger that people start to understand what we're talking about, that community is important. If that becomes their way of life as young people, the chances are they will continue that for the rest of their lives.
We have
more
time for one
question?
last question up here.
Thank you. I feel privileged. The film was amazing. Can I talk? I got the mic. Thank you. It was amazing. Thank you. And I've been working in nonprofits my entire career, and my friend and I, both of us retired recently. I don't like to say I'm retired. I like to say I stopped working temporarily. But from what I'm hearing today, I feel like, and I've worked in mental health and family services, so I have a lot of understanding of sort of what's going on for all ages, I guess. But I think maybe there's an opportunity with your film and in general for like a community-wide advocacy program around volunteering and engaging people, because after working for 30 years, I feel like I don't know where to turn, and I feel invisible. And I know I have something to give, but I don't know where or how. And I continually hear stories of frustration and not getting responded to. So I'm thinking like the Ad Council, when they do those big campaigns around issues, that maybe this is the next issue.
We'll get you a bathing suit. Okay. I'd like to thank everybody. Is that okay?
I want to make one.
You can thank everybody.
I want to make one announcement before we say goodnight, and that
Nothing
is
stops this guy.
sitting in the front row here
Yes.
is the lady who did all of the interviewing. When you,
Wow.
Judith,
stand up.
Judith Bookbinder. If you know anybody that can cause people to open up the way they did with her,
So
I'll
how
put
come
it.
she wasn't on the panel?
Well, she has been on them before.
Oh, okay.
And I want to just give one more shout out. Where do we find out more about the film for people who want to access the film?
It's
There's belowsurfacedoc.com.
There's belowsurfacedoc.com, and there are, and it will tell you how to find it on Lifetime. I think it's on Lifetime. And it was on Lifetime, and we're working to see how to get it out there, because we have a new version without the music you heard, but with music that we've written. And we are hoping to be able, and it will be on the website.
Every JCC in America will want to screen this film, so we'll start here.
Well, that's a good idea, Isaac. Thank you.
I want to give a big thank you to our panel. I want to especially thank Sheila Nevins as well for, you can moderate all of our panels, Sheila. Thank you all for all your expertise and bringing so much to the table here. This has been fascinating. Folks, thank you so much for being here. Join us for more, and we look forward to seeing you. Have a good night.